Welcome back. Well, we have a lot more questions for Dr. Ravishankar on the common problem of migraines. You know, there are some cases where a lot of children do get headaches and one doesn't know why. So how do you differentiate, and what does one do when a child gets a headache? How do you differentiate it between a migraine or a regular headache? Who do you see? Do you see a doctor?
Now, we have seen a number of children who get migraine headaches. The important thing to remember is that the pattern of migraine, children are not littler versions of adults with migraine. The pattern of migraine, the way it presents, is different in children than in adults.
Okay.
Now, migraine is an invisible misery where nothing is seen in the patient on examination and nothing is seen on investigation. Even if you do an MRI, you are not going to pick up any features that are unique to migraine. So therefore, it's most important that you detect migraine or you diagnose migraine by listening to the clinical features of what complaints the patient comes with. And in children, you find that there is the unilaterality or one-sided headaches which are seen in adults are not seen in children so often. They are on both sides and they are more in the front of the head, and you find that children have other complaints like giddiness, travel sickness when they are very young. Whenever they travel, they might throw up, and following that, they might have a headache. And children can present with vomiting and abdominal pain, a condition which is called abdominal migraine, seen much less often in adults. So children can present with abdominal pain, which is also a forewarning that this child is later on headed for migraine with headache. And apart from this, when a child gets trigger-linked headaches in school, particularly when the noise of the school bell ringing, or when during recess the children come down rushing together at the same time, you will find migraine children coming and telling their parents that they are unable to tolerate that noise. They can't stand in the sun during PT or the physical training periods, and they faint sometimes, they fall down. And when certain food items such as ice creams, cheese, pizza, pasta, these items give rise to more headaches, that is the time when the parents should realize that probably the headache they are having is not due to an eye refractive error, but it could be migraine. And the last clue, which is the most important clue, you will find that there is a member in the family, either a mother or a grandmother or a sister, who has also been through a similar situation, and that is when you should approach your pediatrician or a doctor to treat your headaches for the child.
Caffeine, should one have it when they think that they're getting a migraine? Should one have it to probably prevent migraines?
Caffeine is a double-edged sword. In a small quantity, it can help treat headaches. It is a combination in many headache medicines also. But when consumed excessively, it can be the cause of the headache. So therefore, caffeine can do both. It can treat headache in a small dose. It can cause headache in a larger dose.
Okay, all right. Dr. Ravishankar, it's been an absolute pleasure. We have a lot more questions, but run out of time. So I'm sure we'll have a part 2 of this. Thank you very much for joining in and speaking to us in our
Thank you
studio.
so much. It was a pleasure to answer your questions. Thank you.